So it's a really important topic today. It's one of the most important skills that IMGs need to improve and develop. In the PLAB 2 exam, there are three domains that are assessed. The first is data gathering, the second is the clinical management, and the third is interpersonal skills.
Why communication skills are so critical in
The
UK?
PLAB 2 exam is a practical exam.
So what I have learned throughout my training and all work experience in the NHS, communication.
Assalamu alaikum and welcome to today's episode of the Hive Medical Academy podcast, the platform where we guide, support, and empower international medical graduates to succeed in their NHS career in the UK. I am your host, Imtihal Mariam, project lead of Hive Medical Academy at Health Services Academy, Islamabad. Today, we are diving into one of the most important topics of IMGs, communication skills with patients and the common challenges faced in PLAB 2 practical stations. At Hive, we don't just prepare you for exams, we prepare you for real life scenarios, building the confidence and competence needed to excel as doctors in the UK. I'm honored to be joined by a very special panel today, Dr. Shakil, our CEO, Dr. Umar, our academic lead, and Ma'am Asma, our executive member. Together, they have been guiding countless IMGs on their journey to success. And of course, our warm welcome to our dedicated listeners, the Hive team, who make all of this possible. Welcome to the podcast, Dr. Shakil, Dr. Umar, and Ma'am Asma. Let's now move into the question session where we will discuss real challenges and hear insights from our panel.
Assalamu alaikum. Am I audible to everyone?
Alaikum salam. Yes, you are.
This is Mariam Manzoor from Hive Medical Academy as a team member. So my first question is for Dr. Shakil. So Dr. Shakil, as someone who has worked with IMGs from different countries, can you share why communication skills are so critical in UK medical practice and sometimes even more than clinical knowledge?
Thank you so much, Mariam. Thank you so much, Imthal, for the introduction. And yes, the communication, being myself a international medical graduate and transiting from Pakistan to the UK, completing training in the UK, I have a well experience how important are the communication. So what I have learned throughout my training and all work experience in the NHS, communication. Very important with the patient, within your team, or with your colleague. When we are coming from different healthcare system or different country and different culture, communication is a big challenge. We need to learn what's the communication system in the UK, how we need to communicate with the patient, how we need to involve our seniors, when we need to ask for the help and how to ask for the help. This is very important, and this is the biggest challenge for the international medical graduate because during their education, during the medical school, after that in practice, we hardly have any communication with the patient the way we should. So what we say here, treat patients the way you want to be treated, respect patients the way you want to be respected. And listen. Listening is very, very important. We always listen to the patient. The most important thing which I say to all my juniors is ideas, concerns, expectations. Listen, explore, and explain. These are the very important component of the doctor's life. If they want to practice as a good doctor, these are the very important components. So when patient comes to you, the communication, if we focus on the communication with the patient comes to you, they have got some idea. And after that, when patient has got some expectation from you, because you think that, you are the expert, you are the professional, you're going to help them in the communication and, whatever the problem they have got. And they want you to listen. Whatever the problem they're coming with, they want you to listen. Yeah. So listening is also important. So learning the basic communication to deal with the patient, to speak with the patient. I will give you one simple example. There was one doctor. He was from another European country and he was working in the UK. And his communication was not very good. He could not explain to the paramedics that the patient is unwell and come and see the patient. But that was a big dilemma. That was a big case. So communication is very important. I will pass over to Dr. Omar, who is our academic lead, and he will put some more light over the importance of communication, especially in the consultations, especially in the PLAB 2. PLAB 2, they basically just assess how good you are, how good you are communicating with the patient, how safe you are. So, Dr. Umar, if you want to explain a bit more about the importance of the communication, that would be great.
Thank you, Dr. Skeel. Thank you, Imtihal, and the rest of the team. It's a pleasure to be on the podcast again, discussing all the things that are important for IMGs and their PLAB route. So it's a really important topic today. It's one of the most important skills that IMGs need to improve and develop in order to not just pass their PLAB exams, but to practice in the UK. Just to highlight its importance in the PLAB 2 exam initially. So in the PLAB 2 exam, there are 3 domains that are assessed. The first is data gathering, where you take a history, you examine a patient, you get information from the patient. The second is the clinical management. So your discussion around what you think is going on, your approach to what the differential diagnosis is and how you are going to manage that patient. And the third is interpersonal skills, which is another term for communication skills. But obviously, it's a domain in and of itself, and it makes up a large chunk of the marks in the PLAB 2 exam. But obviously, you can appreciate that in history taking, in getting information from a patient, in explaining things to the patient, you also need comm skills. You also need the communication skills to be able to do them 2 parts as well. So it's really a very crucial part. I would say the most important part in the PLAB 2 exam, and the one that international medical graduates struggle with the most. And that's why we focus a lot on it in our PLAB 2 course. And because it's important in the PLAB 2 exams, naturally, it's a really important part of practicing in the UK. So as Dr. Shakil mentioned, there is a shift that IMGs have to make from communicating in the way that they used to when they were practicing to communicating in the way that we want them to now when they are doing their exams or coming to the UK. And we'll explore that a bit more, obviously, as we go through some of the questions.
I just want to add one little story. When I moved to the UK, I passed my PLAB, started my job, and I was working in Stepping Hill Hospital. So where I met one of the doctors, he was quite senior. He was from a different country. पाकिस्तान से था, उसकी भी ट्रेनिंग चल रही थी, अभी जॉब शुरू हुई उसकी. So he was very upset. He said, मैं जा रहा हूँ छोड़ के, मैं यहाँ पे काम नहीं करता हूँ. So this will tell you about the importance of communication. तो मैंने उससे पूछा, तुमने PLAB किया है, अभी वापस क्यों जाना चाह रहे हो? क्या what's the problem? Why you want to go back? तो कहते हैं यार कि मैं वहाँ पे मैंने तकरीबन 10 साल काम किया है पाकिस्तान में. मैंने हर तरह के पेशेंट देखे हैं. आप सिंपल चेस्ट पेन से लेके स्ट्रोक के, पोस्ट स्ट्रोक के, डायबिटीज, एवरीथिंग. तो वहाँ पे तो मुझे कोई मसला नहीं था. यहाँ पे मुझे कुछ प्रॉब्लम हो रही है. मैंने कहा बताओ क्या प्रॉब्लम क्या है. तो वो सिंपली वो कहता है कि यहाँ पे मुझे पेशेंट को ना बड़ी चीजें एक्सप्लेन करनी पड़ती हैं, बताना पड़ता है, कम्युनिकेशन करनी पड़ती है. तो मैंने कहा पाकिस्तान में कैसे करता था? कहते पाकिस्तान में मैंने कोई हजारों के हिसाब से पेशेंट देखे हैं. तो जब भी कोई पेशेंट मुझसे पूछता था कि डॉक्टर साहब ये बात तो ठीक है, मुझे हार्ट अटैक हो गया है, तो मुझे बताएं कि मैंने परहेज क्या करना है, कौन सी चीजें मैंने अवॉइड करनी है. तो मैं हर पेशेंट को कहता था यार कि कोई ऐसी वैसी चीज नहीं खानी. तो ड्यूरिंग माई 5-6 years ऑफ प्रैक्टिस, वहाँ पे किसी बंदे ने, किसी पेशेंट ने मुझसे क्वेश्चन नहीं किया कि डॉक्टर साहब ये कोई ऐसी वैसी चीज क्या है जो मैंने नहीं खानी. तो सिंपल. तो यहाँ पे मुझे जब मैं पेशेंट को कहता हूँ कि यार यू हैड अ हार्ट अटैक, यू नीड टू गो बैक, यू नीड टू अवॉइड दिस थिंग, तो पेशेंट मुझसे पूछता है कि डॉक्टर साहब मुझे बताएं, पूरी लिस्ट बताएं कि कौन कौन सी चीजें मैंने अवॉइड करनी है, कौन सी खानी है. तो दिस इज, यू कैन अंडरस्टैंड द ह्यूज कम्युनिकेशन गैप. कि वहाँ पे आपके रिफ्लेक्सेस ऐसे बने होते हैं कि वहाँ पे आपको पेशेंट को कोई चीज एक्सप्लेन नहीं करनी है, पेशेंट क्वेश्चन भी नहीं करते हैं. बट हियर इफ यू कमिंग टू प्रैक्टिस इन द यूके, पेशेंट विल आस्क यू एवरीथिंग. Okay, why you're giving me this medication, what I have to do, what I have to avoid, and what are the next steps. So this shows that how important are the communication.
So my next question revolves around that: in what ways does the Academy's training connect exam preparation with the practical requirements of NHS job application? to Dr. Umar.
Okay, so the way, obviously, the whole setup of the academy and the courses are designed to focus on the things that are important for clinical practice. So obviously, we prepare candidates for the exams, but it's not just keeping the focus of the exams in view, because the skills that we discuss and develop and practice through our courses are the skills that will make them successful in their clinical practice in the UK. And of course, that's the whole purpose of the PLAB exams. They're not just there as a tick box, as something, just to to get your GMC registration. They're actually designed to uh, select people who have the skills to practice safely in the UK, whether that's clinical knowledge, whether that's the communication skills that you need. So everything about our courses and everything we do in the academy is geared towards your future medical career. And as we, tend to mention um, every time we speak, because we're really proud of the fact that we don't just prepare people for the PLAB exams, we actually we get them ready for the job. So after they've passed their PLAB exams, we still continue to support them in improving their CV, in practicing mock interviews, and helping them in the job applications to try to make them successful.
Okay, thank you so much.
Sir, I have some questions from Dr. Umar. My first question is, sir, could you please tell us that sometimes patient can be anxious, upset, or even angry. How should IMGs handle these situations while keeping their professionalism intact?
Yes, so thank you. Very important question. These are common scenarios that come up in the PLAB 2 exams. And as we've explained, this is because they are real scenarios that occur in the real world in the NHS, and I'm sure in Pakistan and India and in other places as well. I'm not going to focus on what we do in Pakistan and India because that's not my role here today. What I'm going to focus on is how we should handle these situations for the PLAB 2 exams and then afterwards, obviously, in NHS clinical practice. So if a patient is angry, of course, there's a reason behind it. There is something that has upset them. And, consulting skills are not too different from having a conversation. So if you just put yourself in a scenario where you're speaking to a relative or a friend and they are angry or upset, think about how are you going to manage that situation. You are not going to you're not going to uh, dismiss their emotions. You're not going to kick them out of the room or say, I'm not going to see you, go see somebody else, or something along them lines. What you're going to do is you're going to allow them to express their emotions. Say, no problem, I can see that you are angry or you're upset. Please, go ahead and share what's worrying you. Let them vent, let them get the emotions out. Acknowledge their emotions. So say, I understand why you are angry, why you are upset. Show some empathy. If I had gone through that situation or if I was in your situation, I would feel exactly the same. And then after you've given that positive response, then let them know that you're here to help and that you are going to discuss with them how to improve the situation or how to take things forward. So that's a very basic kind of summary of how to approach that kind of situation. Obviously, when candidates come to the academy, we practice this in all kinds of scenarios. Patient's relative has died unexpectedly. There was an error done by either the medical or the administrative team, or they've been waiting a very long time. So lots of these different types of scenarios can result in this kind of presentation, and we go through and practice in detail how to handle them. But the basic concept is the same. You allow the person to express their emotion. You don't, you respectfully give them space. You listen. You acknowledge it. You show some empathy, and then you say, let's discuss how to move things forward.
How can IMGs navigate where a patient cultural or religious beliefs influence treatment decisions?
Okay, understood. Thank you. Yeah, another very important question. And the first thing to say is that the UK is a multicultural environment. People have different religions, people have different cultural backgrounds, they have different um, even things like gender and that kind of thing are they're very varied kind of backgrounds and approaches and beliefs. And so it's the most important thing, first and foremost, is to be non-judgmental. We're medical professionals. We're there to listen to patients. We're there to explore what's going on in their life. And we're there to help them and to give them advice. But from the point of view of a somebody who's removed from the situation, without judgment, without favor, without criticism. So our job is to explore what's going on in the patient's life and to give them sound medical and health advice, and not kind of favor one particular group over the other, or to express our own personal beliefs about these kind of things, because that's not what our job is. And the GMC's guidance, the medical regulator in the UK, is very, very clear in how we do that. Now, again, maybe things are done differently in countries abroad outside of the UK, where it might be more acceptable to share your own personal beliefs or to give them advice based on that. It's not something that should be done in the UK. So we should stick to what the medical advice is. We should stick to what's best for their health, regardless of their culture, their background, their gender, or anything else.
My question is for Dr. Omar.
Yeah.
So let's talk about PLAB 2. What are some most common challenges IMG face in their communications heavy stations?
Yeah, great. So another very important question, and obviously the first parts of the journey of somebody coming to the UK will be their exams, and so it's important for us to focus on that. There are many challenges that IMGs will face in PLAB 2 scenarios. Hopefully, they'll have prepared well. Hopefully, they'll have had some guidance from people who have worked in the UK, who've examined, who have taught on, taught OSCEs and examined OSCEs. So they will have had some preparation. But the challenges do center around how they um, how they converse with patients, how they listen to patients. And the challenges will center around the language that they use and the language that the patients use. What I mean by that is, obviously there are certain what we call nuances of communication, where certain phrases, certain things are said, and they actually don't necessarily mean literally what they are saying. And sometimes, as a person who comes into English as a second language, it's difficult to understand that. Sometimes IMGs take it literally, or they don't get what is being implied. And so it's these kind of skills that we tend to focus on and practice with them during their preparation. But ultimately, I mean, we have to remember that the IMGs, whether they are fresh graduates or whether they are doctors with years and years of experience, they have all the knowledge there. So the knowledge is there, the experience is there. Obviously, we have to align that and change that a little bit to make sure it fits with UK practice. But they need to be able to give space to patients. They need to be able to explore the patient's ideas, concerns, expectations. They need to be able to place the patient into their psychosocial context, understand the patient, what is going on in their life, in their home, in their work, and they need to get all of this information, put it together with some medical knowledge, and then try to explain that to the patient or negotiate and discuss that with the patient. So these are very, very high level communication skills that they need to work on, over the period of a few months to try to bring them up to speed.
Okay, thank you so much, sir.
You're welcome.
My next question is for you, Dr. Umar, again.
Okay.
That and in practice procedure stations, how can candidates maintain good communication while focusing on their technical skills?
Yeah, so again, in practical procedures, the same principles apply of patient-centeredness. You have to put the patient at the center of everything. So the patient will need a good, clear explanation of what is going to happen, or what the doctor needs to do or intends to do. Obviously, the doctor will need to take consent from the patient. They'll need to take permission to do the examination or the procedure. They will need to ensure that there is a chaperone present where relevant for that kind of procedure or examination. And also throughout the procedure or examination, they need to ensure that they are checking with the patient whether they are comfortable, making sure that they are not, they're not causing pain to the patient, and continually telling the patient throughout what they are doing. So these are the kind of things that they need to focus on when thinking about practical procedures or examinations. And then afterwards, at the end, summarizing what they have done, what they have found, and what the next steps are going to be.
Thank you so much, sir.
You're welcome.
Assalamualaikum, everyone.
Walaikum salam.
Sir, my question is from you.
Sure, no problem.
Breaking bad news is always tough, even for experienced doctor. How should IMGs structure their approach and PLAB too?
Yes, a very important question. As somebody who worked in clinical practice for around 15 years, breaking bad news is a very, very challenging type of consultation. No matter how many times you have done it, it's always difficult. And so in these kind of situations, for when we are teaching people how to do it, it's helpful for them to have mnemonics or acronyms to try to remember. So for breaking bad news, the one we use is SPIKES. So that's SPIKES. The first S is for setting, which means you ensure that the where you are having this conversation is appropriate. You're not stood in the middle of the ward, or you're not stood in a corridor. You have a private space. P is for perception. So you have to explore what is the patient's understanding of what the situation is currently, so that you can then tailor your explanation to their current understanding. I is for invitation. So you have to check with the patient that they are ready and they actually want to receive the news that you have to give them. Because in the UK, it's all in the patient. It's all up to the patient whether they want to know fully what's going on or not. It's up to the patient, not their family, not their relatives, not their father, husband, brother, anything like that. It's all about the patient. Then the K is for the knowledge. So after a bit of a warning shot where you say something like, I'm really sorry, the news isn't good, or I've got some bad news, unfortunately, you get them prepared for that, and then you tell them what it is sensitively. E is for empathy. You will then empathize with the patient, give them space to absorb it. Tell them that you're there to support them, and you understand this is a difficult time. And then the final S is for summary and strategy. And then what you will do is you will summarize what was discussed and discuss how to move things forward. Now, obviously, that's a very condensed view of what happens in that kind of consultation. There will be there may be lots of questions from the patient. There may be lots of toing and froing. There may be lots of silence, because discussing bad news, patient might need time to take things in. But that's one of the tools that we use to teach IMGs how to do that.
My another question for you. Before the exam, what are your top 3 practical tips for IMGs to polish their consultation and communication skills?
Okay, thank you. So, really good question. The PLAB2 exam is a practical exam. Okay, so you need knowledge to pass it as well. But what's more important than studying for PLAB2 is practicing for PLAB2. So they have to use example scenarios, example cases to practice how they are going to take a history, how they are going to explore things, how they are going to explain things. And they need to practice with the most experienced people who are available. Now, obviously, if these are their peers who are also going through the PLAB2 exam, then that's fine. That's also good. But ideally, they need to practice with people or be observed by people who know the NHS inside out, have worked in the NHS, know which things are important, have examined OSCE examinations, and have taught. Because it's not practicing just with people who are also preparing for the PLAB exams. They might not necessarily be able to highlight the areas that you need to improve or tell you how to improve them. And so they need to be observed by an experienced a tutor or examiner who can highlight the things that they are doing well and the things they are not doing so well and how to improve them.
Thank you so much, sir. My last question is for you. Are there any resources or method you recommended for improving both verbal and non-verbal communication?
Sure. So, in terms of the top resources I'm going to recommend are obviously the ones that Hive prepares. We've spent a lot of time putting these courses together for both PLAB 1 and PLAB 2, and for the journey after the PLAB. So I would recommend Hive's resources. But in terms of other resources that they could maybe also use to supplement that or explore, there's lots of helpful guidance out there from the GMC in particular in terms of how to handle certain situations, important ethical and legal considerations. But verbal and non-verbal communication is not something you can learn about from, you can learn about it from a book or from an article that somebody has shared. But in order to improve verbal and non-verbal communication, you need to practice and you need to put yourself in that scenario with somebody who takes you through and shows cues and gives clues that you need to pick up, and also who will highlight how you yourself can improve your verbal and non-verbal communication. That's really the best way to do it. And as I've already said, practicing with an experienced professional who can see what's happening and give you live advice is the best way.
Okay, so the last question of this session is for Dr. Umar. If you could give just one piece of advice to an IMG about to face their PLAB2 exam, what would it be?
Okay, for somebody who's like literally about to give their PLAB2 exam. Okay. The best advice I think is focus on the situation in front of you. It's a couple of things. Focus on the situation in front of you. Don't compare it to things you have read about or particular cases. Focus fully on the patient, what they are saying. Give them, spend a lot of time listening, getting information. Be empathetic. Show empathy. Show that that you have practiced them high level communication skills, and be clear in your explanations. Slow things down. Don't rush. Don't use stock phrases that sound rehearsed or sound clumsy. So these two or three things I think would be most important, and obviously you have to stay calm in whatever situation, even if you feel something is going wrong, the station isn't going well, you can stay calm, composed, collect your thoughts, take a few seconds if you need, have a reread of the scenario itself, or just say, I'm just going to gather my thoughts, and people are very understanding about that kind of thing. These are probably the things I would say.
Fantastic insights, Dr. Omar. Thank you so much for joining us today. And to our listeners, remember, clinical knowledge is important, but how you communicate can make all the difference in the exam and in real NHS practice. Thanks for turning into the Hive Medical Academy podcast. If you found this episode useful, don't forget to follow us for more guidance, tips, and success stories for IMGs. Until next time, please keep learning, keep growing, and keep caring. Thank you so much. Allah Hafiz.